Hello friends and welcome back to my channel. Today I'd like to talk about some considerations for getting pierced if you have HIV. There is unfortunately still a lot of stigma about working on HIV positive clients in the tattoo and piercing industry, and despite our best efforts at educating folks and trying to defeat this stigma, it still does persist quite a bit. This past week, if any of you saw, there was a video that went very viral on TikTok of someone getting declined for a tattoo over their HIV status. I'd like to start this out by saying that that behavior is completely unacceptable and discriminatory, and there's also just really no reason for it. When we as piercers and tattoo artists talk about working on clients who are HIV positive, there is really basically no risk to us. All of the risk is really to the client, which makes it an incredibly humbling, honoring experience to be trusted to pierce or work on someone who is HIV positive. Now, what do I mean by the risk is really to the client and not to us? Well, I'd like to start by pointing out that there has never once been a confirmed case of transmission of HIV through tattoo and piercing. It just hasn't happened. But HIV is an autoimmune condition, and it causes a person's immune system to be a little bit weaker. So when we are doing things like breaking the skin, and especially when we're breaking the skin and creating a very long healing wound like a body piercing, this is a prolonged opportunity for someone with a weakened immune system to potentially deal with infection, irritations, issues with wound healing. So it's incredibly important that the person who is making that wound is really doing an incredibly good job, because anyone with an autoimmune condition is at a higher risk of having problems with things healing. This includes folks who have HIV, but it also means folks who have hepatitis, folks who have herpes, folks with psoriasis like myself, or eczema, folks with PCOS, folks on certain medication. Anyone whose immune system is just not in a really great state could potentially deal with this. So when someone who is HIV positive comes to an artist and trusts them to do a piercing or a tattoo, there's very incredibly minimal risk, basically no risk to the artist at all. It's really the client who's taking on the risk of getting something like this that needs to heal and could potentially have issues with the healing process. Now, aside from the fact that there's, again, never been a documented case of transmission between tattoo and piercing, one of the big reasons why it's so low risk for us as piercers and tattoo artists is something called universal precautions. This is basically the concept that you never know if a client sits down on your table if they have something or if they don't. Half the time, they might not even know if they have something or not. So every single client is treated like they have everything that we could possibly worry about. We're always wearing gloves when we work. We're always using fresh, clean gloves. We work in sterile gloves. We're always using single-use needles, single-use instruments. Most of the studios that I work at are disposable, so anything that comes in contact with a client is disposed of afterwards, just so that we don't have to worry about anything. And we're wiping down every single surface a client comes down with a tuberculocidal disinfectant that does a really good job of killing any and all bacteria on the surface. And we are cleaning surfaces in our studios dozens, if not hundreds of times a day, depending on our volume. So cleanliness-wise, transmission-wise, it is super safe for us as practitioners to work on folks. Now, I've done a couple different video series about my suggestions for clients with herpes and psoriasis and eczema here on my channel, all of which are autoimmune conditions that can make healing more difficult, and HIV is also one of those. It does mean that if you're considering getting pierced and you're HIV positive, there's some extra considerations for you to have with your piercing. The first and foremost is that prolonged healing is really common. Any kind of immune system disorder. I strongly suggest being on antiretrovirals for the duration of your piercing healing to make sure your body is in as healthy a state as possible to get and heal a piercing. I would also say err on the side of caution for the whole healing time. So, for example, if you know you're someone who swims a lot, maybe get pierced at the middle of fall when you're not going to be swimming through fall and winter. That way you just don't have to take the risk of infection from bodies of water or bacteria in water. If you know you need to wear headsets occasionally for work, consider focusing on piercing just one ear. That way you don't have to potentially deal with irritation from things that you're wearing. Just tiny little lifestyle changes to be a little bit safer than some other folks need to be with their piercings to make sure that your body stays healthy during the full healing process. And of course, one of the biggest factors is working with your piercer. Anytime someone has a condition that affects their immune system, I always find that it's a little bit easier to heal if you do some regular check-ins with your piercer, usually like once a month, just because we'll be able to see signs of irritation issues forming long before you will, and we'll be able to offer advice on how to prevent irritations from getting worse or keep things healthy and happy. But overall, I actually find that an HIV diagnosis affects piercing far less than things like my psoriasis or eczema or skin condition. In fact, of all of the autoimmune conditions that I've worked with pretty extensively as a piercer, my clients who have had HIV have been some of the best healers and best clients that I've worked with, bar none. And I think it's really important for me to say that I am so proud and so honored and so humbled to say that I've worked extensively with clients who have HIV. As many of you may know, I spent 5 years piercing in Broward County. That is one of the highest concentrations of HIV in America, and dozens, if not hundreds, of my clients were HIV positive. And I am so grateful that they trusted me with their bodies and trusted me to work on them. It breaks my heart every couple of months when a video like the one that just went viral on TikTok comes up and I see people being denied these services purely out of a place of ignorance and hatred and fear. And it's really upsetting to me that in the year of our Lord 2023, tattoo artists and body piercers who should be taking bloodborne pathogens classes every year, who should be educated and knowledgeable about this, are just clearly showing how much they don't know if they're turning away clients like this. The risk in working on HIV positive patients is basically none for us as practitioners. This is why universal precautions exist. So I hope that by making this video, and I have a whole blog post about doing piercings when you are HIV positive that I'll also link in the comments below, and other piercers and tattoo artists like myself trying to encourage folks that this is safe and that we are so happy to work on you. We can continue to change the industry and continue to get rid of some of these just archaic and not even founded in fact biases that we still see circulating around the industry. I am so sorry to anyone who has ever experienced discrimination from tattoo artists or piercers over this. Please know that not everyone is like that, and please know that there are so many of us out there who would be beyond happy and beyond honored to work with you and to work on your body and to be trusted with something like that. Your support means the world to me, so please like and subscribe if you enjoy the work that I'm doing here on my channel, and I look forward to sitting down and chatting with y'all again soon. Have a wonderful rest of your day. Bye!